Good evening and welcome. I'm Diane Meyerhoff, host for tonight's candidate forum for Chittenden County State Senate. Today's show is being aired live on Channel 17 and streamed live on the Channel 17 website. We welcome your comments and questions. Please join the conversation at 862-3966. The Chittenden County Senate delegation is made up of 6 candidates, 6 seats. As such, we'll be talking to each candidate in 3 separate groups. Tonight, right now, joining me are Democratic incumbent Debbie Ingram, Fair Representation Vermont candidate Joshua Knox, Democratic incumbent Ginny Lyons, and Republican Paul Dame. Thank you all so much for joining us tonight.
Thanks for having us, Diane.
Of course. The ground rules for tonight's forum is that the candidates will make opening statements of up to 2 minutes each. Then they will answer prepared questions, also for 2 minutes, with a possible 1-minute rebuttal. We'd like the candidates in their opening statements to talk about why they're running and the experience that they will bring to the position. And we're going to start with Debbie.
Thank
Welcome.
you very much. Yes, thank you. Thanks to Channel 17 for having these forums. It's very important to help people understand who we are, especially when there's so many of us, right? My name is Debbie Ingram, and I am a current state senator. I serve on the Health and Welfare Committee and on the Education Committee, so those are issues that are of particular interest to me. I also bring experience from the municipal realm. I served on the Williston Select Board for 6 years and the Williston Planning Commission for 5 years and on the Chittenden County Regional Planning Commission. And in my day job, I am the executive director of a nonprofit called Vermont Interfaith Action, which is a grassroots coalition of caring and inclusive congregations that work together to affect systemic change around issues of social justice. So through that work, I have acquired quite a bit of knowledge in affordable housing and healthcare, transportation, education, criminal justice reform, and economic dignity. So with all of those different hats, I feel that I bring quite a lot of experience and knowledge to the state Senate. And I also have the opportunity to really listen to everyday Vermonters on the ground, at the grassroots. And I think that's something that is very important. I've always had a heart for justice and a lot of compassion for people and what they go through. And I think that's a very important part of my role in the Senate. I'm there, in my opinion, we're all there to contribute to our communities, but to make the lives of Vermonters better, and that's what I'm trying to do.
Thank you. Joshua, opening statement.
Yes, hi, I'm Joshua Knox, of course, running for Chittenden Senate. First of all, I'd like to thank the other candidates for being here. This is a great, great forum for democracy.
We like that, Forum for Democracy.
Yes, you should trademark it. I'd like to thank my wife Melanie and my son Everett for letting me upend our family schedule again, running around the county. Here we are again. So I'm running to bring more voices to the state legislature. In my day job, I am a teacher at Mount Mansfield Union High School in the Chittenden East District. I have been on the Ethics Planning Commission now for about 5 years. And between those two things, well, I'll talk about being a teacher first. If you're a teacher for any amount of time, what you become is sort of a sounding board, you become a willing ear, you become almost a confessional. And so there's a lot of stories and voices that I hear on a regular basis that I don't necessarily hear reflected in our politics. And we often say in education that every social issue comes through our door first, and they all come in together. And so when I think of the issues we're going to talk about, when I talk about opioids or affordable housing or how to make Vermont a better state, I don't think of statistics, I don't think of anecdotes. I think of faces of students and friends and neighbors, and it's about stories for me and weaving those stories into a narrative about who we are as a state and who we can be for this generation and generations to come. Thank you.
Great, thank you. Ginny, opening statement.
Thank you, Diane, and thanks to Channel 17. This is a terrific opportunity for not only for us sitting at the table, but also for the folks out in the audience. And we greatly appreciate being able to share with our constituents. I am in the Senate now, and I look forward to being back in the Senate in January, and I would ask for your vote, and I'll do that up front. You know, my experience it came from being on my school board and then serving for nearly 10 years as chair of the Williston Select Board, when we went through some very difficult times that divided the town around development. And I think most people are familiar with the Williston Taft Corners area. That was such a difficult time, not just for me, but for everyone in town, and it took a lot of energy on my part to bring people together. When you're sitting on a select board, you're not sitting as a Democrat or a Republican or a progressive or an independent. You're sitting as a citizen trying to make the community a healthy environment. So that's part of my experience. Another part of my experience, of course, has been in the Senate, and I look forward to talking more about that as we go through the program. I also have served as a professor of biology at Trinity College in Burlington for over 27 years, and got to know not just Burlington, but also the issues that are intrinsic to biology and the environment. All of the social issues that we face today, whether it's addiction, whether all of our public health issues, are really embedded in our environmental ethic and our interest in science and natural resources. So I bring a lot of experience from my background working with those in the social sciences as well as those in the natural sciences in a very practical way to the Senate. And I look forward to going back and representing the citizens who I listen to year-round through email or meetings. And thank you. So it's good to be here.
Thank you, Ginny. Paul, opening statement.
Thanks. So two things, who am I and what do I hope to accomplish? So my name is Paul Dame. I grew up on a dairy farm down in Brandon, Vermont, and came up to the Burlington area when I enrolled at UVM. And I had the awesome privilege to live and work downtown in Burlington for about 9 years. And so I know what it's like to live downtown, work downtown. It was great using my car once or twice a week when I had to get groceries and being able to walk to work. And so I realized how important it is to have a walkable city in Burlington. Then once I got married, my wife and I moved out to Essex Junction, where we lived for 8 years. All 3 of our kids were born while we were out there. So I also understand kind of the outside of the Burlington area in Chittenden County, the suburban areas like Essex, Williston, South Burlington. So I understand those areas as well. One of the reasons that I'm running is I own my own financial services practice. And I've seen, unfortunately, a lot of my clients who are getting to retirement, looking at the cost of living on a fixed income, and some people can't do it anymore. And I want to continue to serve people here in Vermont. I want people that love Vermont to be able to stay here. If they like the warm weather, that's fine, but that's not the only reason. And so I want to make sure that we keep Vermont a place that folks can stay in. I served, while I was in Essex, I served in the House of Representatives there and served on the Human Services Committee, so to Ginny's counterpart there in the House, and dealt with a couple of, one of the main issues that I want to focus on, which is the opioid epidemic. It's one of those areas that I know that if we can be intelligent, be smart, be careful and compassionate about, it's an area that we can see a lot of progress in other areas. The second issue, which is also related to that, is creating more opportunity, economic opportunities for Vermonters. We need to maintain Vermont's ability to be a great place to live, work, and play, and make sure that the employers that are around here that give us all an ability to put food on the table and enjoy the recreation in Vermont, that those employers stay here and expand. And so those are the 2 key reasons I'm running to kind of get promoted from the House to the Senate with your help.
Great, thank you very much. Let's talk about the economy. According to Forbes magazine, Vermont's economic outlook is projected to be the 2nd worst in the United States over the next 5 years, while income growth is also expected to lag behind. Do you agree with this assessment, and what is your plan of action to strengthen Vermont's economic outlook? And we are going to start with Joshua.
I do agree with that, and since I announced I was running, I've gotten a lot of emails, Facebook messages, Twitter, whatever, from former students who would have loved to stay in Vermont, but were unable to. And so I entirely agree with that. I think one of the traps we sort of get into in Vermont is, and both parties do this, but they tend to try to play catch up with bigger states. And what I mean by that is about offering a better deal for businesses to come here. And my view is that we can always be undercut, if you will, in the race to the bottom. Vermont's going to lose. It's a small state. It's a brave little state, but it's a small state, and so there's that difficulty. So my approach would sort of be two-pronged. One would be to make it easier for people to stay here on the labor side of things, and I hope what we talk about are things like affordable childcare, early childhood education, making those things affordable for working Vermonters, because you need a workforce that's willing to put down roots here, people that are willing to put down roots here. That's one side of it. The other side, and I think we'll probably talk about it as well, is the entrepreneurial culture. We're not, like I said, going to attract large businesses necessarily of the old type. I don't think that's necessarily what Vermont's strength is going to be. But I think our strength is a local entrepreneurial culture from which we can build up. And you see that in sort of our agricultural products, like I'm a fan of the sort of cider boom revolution we have going on, things like that. That's going to be the Vermont future, some small niche thing that Vermont does well, and that's what we need to support.
Okay, great. We're talking about strengthening Vermont's economy. Ginny.
Thank you. First, I don't know which article from Forbes did this prediction come from.
I know it's fairly recent.
Pretty recent?
Someone did look it up.
Okay, but it's a crystal ball about the future,
Yep.
and sort of, I don't know how predictive it is based on the work that we've done recently. You know, I think that Vermont is a little more resilient than saying that we're going to fail over the next 5 years and we're going to be second lowest. Maybe we will, but I'm not willing to give in to that thinking. I think that we have a lot of challenges. There's no doubt about it. I do think that some of the comments we hear about keeping young people in the state are pretty right on. But on the other hand, we've seen a remarkable growth in our solar industry, not just in putting the panels up and having the workforce to do that, but also in the production of solar product as well as other energy products. We have wonderful biotech companies, including one right across the bridge here in Winooski. So, and we have maker hubs beginning across the state. We know that we have telecommunications that is lagging, but we're focusing that telecom in specific areas so that we can build that telecom industry in a way that is Vermont specific, small business specific. We've invested in our working landscapes through the Enterprise Board. We're diversifying agriculture. We have wonderful small businesses that are selling butter to restaurants in New York, and beef to New York, to high-end restaurants. So Vermont, the label Vermont is valuable in and of itself. I'm not willing to give up on Vermont over the next 5 years. So you can see that I'm very high on our state. But I do think that the challenges that we face in terms of childcare, in our past budget, we added, we increased the earned income tax credit for folks with kids so that it would be now 36% of federal level instead of 32%. So people will have some benefit to invest in their young kids and
I'm
growing.
going to stop you there.
Okay, I mean, we could go on, but I think that we're a little more resilient than saying what the article has said, and I'd love to see the article and see what it's based on.
Okay, great. Finally, Paul.
Yeah, I'd say I agree with Ginny that I do believe Vermont is a robust, resilient place. We're kind of Yankee can-do bootstrappers up here, but that doesn't mean that there aren't barriers that can be frustrating for Vermonters. I think 4 things off the top of my head that I think can improve the business climate and therefore the economy is looking at addressing the cost of electricity. I just had somebody come to look at our house and looking for solar panels. And they told me that Vermont is the 5th most expensive utility rates in the country. It's hard to attract business here with a number like that. So we've got to make sure that we're looking at policies that are producing a competitive environment where we can get our utility rates across the board. Whether you're a big company like Global Foundries in my hometown in Essex Junction, or you're an entrepreneur and you're in a maker space and it's just you and your laptop, you got to have power. In the information economy, we've got to have that. The second issue is permitting. I think we have a very complex problem. We've got a big hole in the middle of downtown Burlington because of issues related to permitting process, and investors don't understand what the process looks like. How do we move forward? When can we move forward? It's too complicated. And in my backyard again in Essex, you've got the Circumventual Highway. I mean, you have a problem when the state starts building a road that it doesn't know that it can't finish. The permitting process is too complicated. Third thing we need to do is make sure we're increasing wages for Vermonters. It's really easy to say, hey, we're going to try to raise the minimum wage, but that only helps the people at the bottom. I think if we can make Vermont a place that's a more robust, vibrant economy, we can create more opportunities where companies are competing for wages. That's going to bring wages up for everybody, low, middle, and upper class. And the fourth thing is personal experience, is helping sole proprietors move from 0 employees to 1. If we can do that simple thing, help every sole proprietor who's working just by themselves, whether you're a plumber, electrician, you don't have somebody to manage your schedule, do your books, being able to go from 0 employees to 1 can make a huge impact in those services becoming available to a greater group of Vermonters, and providing jobs and helping that individual focus on what they're good at. I know for me it was a big step when I hired my first employee earlier this year, probably something I should have done a year and a half ago, but there was a big concern about all the regulations and restrictions that would be on me when I went from 0 employees to 1. And I think we've got to make that a smoother transition for sole proprietors.
Great, thank you. And Debbie, we're talking about strengthening Vermont's economy.
Yes, well, I did actually look up the Forbes article.
Yay!
And it was, well, it was somewhat surprising to me because since the 2008 recession, Vermont has had the second fastest growing economy in New England. So I'm not sure exactly how they arrived at their figures, but I do think there are things that we can do to address both parts of what you mentioned, which is to make a better business climate, but also to address the stagnant wages. In terms of helping our businesses, our small businesses, I think especially flourish, because I agree that we're not a prime site for large manufacturing companies. But when I talk to small business owners, I hear from them that there are kind of 3 things that they wish were improved in Vermont. One is it's very difficult for them to find skilled laborers, and I think that's partly because Vermont is actually dead last in the nation in spending on our community and state colleges. And I think we should invest more money in that to help our Vermont young people get the skills that they need for good jobs. Secondly, our housing is so expensive, it makes it difficult for businesses to recruit and retain workers. When people are paying more than 30% or more, even sometimes more than 50% on their housing, they don't have, this isn't a good place for them to live. So we need to work on that more. And then thirdly, our infrastructure broadly defined needs to be improved. I think we're making some strides, but we need to continue to look at the energy sector, our utilities, our telecommunications, especially to our rural areas, and our roads. And then on the other side of the equation, looking at our wages, they have indeed stagnated, which makes it very, very difficult for our economy to grow. And that's why the majority party supported and passed raising the minimum wage gradually over several years, but to get to $15 an hour. And it's very unfortunate that the governor vetoed that. I think that's definitely a measure that we need to use to help Vermonters and help our economy.
Okay, thank you. Let's turn over to healthcare. How do we limit healthcare spending in Vermont while also remaining one of the healthiest states in the nation? And Ginny, you're going to start us off.
Okay, thank you. As Vice Chair of the Health and Welfare Committee, I've been working very hard on this issue. Also a member of the Finance Committee, so it's a challenge actually to look at how do you contain costs at the same time improving quality. But we know that we've made great strides. not the least of which, and there's some controversy about this, of course, but having the accountable care organization through in our area through our medical center, the UVM Medical Center, and knowing that now the medical center is not only taking care acute care for people who are in the hospital, but we're also seeing an extension of care. So when people leave and they have to go home, there's a place for them. So our Visiting Nurse Association has become very much involved. Our Choices for Care program, where people can stay at home or go home and receive care early. So that increased quality of care, and at the same time, a shorter stay in the hospital that just does save money. So, and the SASH program, of course, which is really important, and especially, again, for those who are in our affordable housing environment. But I do think that so many things that we've done, like telehealth, where folks are monitored for their health off-site, or telemedicine, where people actually can access a physician's office off-site. So the physician is sitting in his office and the patient is in another far away getting care, and that saves travel time and it does overall save money. One of the more significant things that we've done in this state is something called the Blueprint for Health, which looks at which is a chronic care initiative and has built, I think, for Vermont, a real opportunity around primary care. So as we build primary care and preventive care for every single age group, then we're saving money on those chronic conditions that might emerge later on, including heart disease or diabetes. So this is exciting. It's a nationally recognized program that we have developed, and I think is going to allow for us to expand into primary care. We're working on things like prescription drug cost containment. We passed a bill this year on drug importation from Canada, where we can lower costs. So there are a lot more things.
I know.
So I will stop.
Paul, healthcare spending.
Yeah. I think, so often it's easy to get lost in addressing insurance and coverage issues, and what we really need to be focusing on is addressing the cost of the care, the cost of delivery. We talk about different payment models, and all we're doing is kind of playing a shell game and pass the buck. If the cost of going to the doctor, if the cost of the treatment at the ER goes up, it doesn't matter who's paying for it. We're all going to be paying more. So I think we need to make sure that we do the things that have proven to bring prices down. That's present patients with more choice. Allow them to have greater choices in terms of how they manage their primary care, whether they do it under a regular fee-for-service model. That's great. If they want to be part of like a concierge service, if that's appropriate for them and their particular health needs, allowing them to do that. Also, allowing folks to figure out what kind of insurance makes sense for them. Unfortunately, Vermont is the only state in the country that makes it illegal to buy health insurance outside the exchange. Why are we limiting people's choices? Yeah, the exchange have a good, robust plan, but some people don't want that. Some people want something that addresses just what they need, and I think we need to give patients those choices. We need to get government and insurance companies, in one degree, out from in between the patient and their physician. I think another thing that was a concern that was mentioned at the community of elder Vermonters that we went to on Friday was they have some real concerns about the ACO model. We've got one of the best parts of healthcare in government is Vermont's Choices for Care model that addresses long-term care needs for Vermonters. That's something that's working well, that people are happy with that program. It's reducing costs, and more importantly than reducing costs, it's helping Vermonters get the treatment in the setting that they want and that they're comfortable with. And the folks who like that program, are happy with that program, are very concerned about the changes that could come with that. It's one of the problems of kind of throwing the baby out with the bathwater and trying to remake the system top down, is that we have parts that are working well, especially for elderly Vermonters. We've got to make sure that we maintain that for them. So I think it's basically providing more choices for patients and make sure we understand what we're doing well and keep doing it well.
Okay, thank you. Debbie, healthcare spending.
I appreciate Mr. Dame being such a good proponent for a particular point of view, and I would say that I'm probably 180 degrees from what he just articulated. I think that the ACOs are our best hope for working towards a system that that is based on healthcare as a public good, which looks at it in more of a universal way. Long term and ultimately at the national level, I am a strong supporter of a single payer kind of system, Bernie's Medicare for all. And I think we should do as much as we can in Vermont to move towards that. And the good thing about the ACOs is that they move us from a fee-for-service system into a payment per person in a regional area. And they encourage doctors to physicians, healthcare providers of all kinds to work together to provide coordinated care and to keep the people in their region healthy. And not spend unnecessarily on things that are not needed. So I think that they are going to lead to greater savings. I am also proud on the Health and Welfare Committee that I serve on and that Senator Lyons serves on. We moved forward a universal primary care system. We're trying to move Vermont closer to that. Because in areas where they spend, states or countries where 20% approximately of the general health care spending is spent on primary care, there's greater long-term savings and people are healthier. You have much better outcomes. Right now in Vermont, we only spend about 6 to 7% of our total spending on primary care. So the more we move towards that preventive care, the healthier our population will be and the lower our costs will be.
Okay, great. Joshua, healthcare spending.
Yes, I would absolutely agree with the idea that primary care and preventive should be the objective. I agree with that. I would differ a little bit in how we get to a larger healthcare system, like a universal care, a Medicare for all, if you will. I think it's Christine Halquist has sort of an interesting idea, if I'm attributing it correctly, to partner with other states. And the reason I like that a great deal is if you look in what Canada did in building up their system, it came from the provinces first. And as I said earlier, Vermont is a small state and we're one of the oldest states and we've got a low birth rate. And so long as we do have a private insurance market that exists, and those are the economic incentives, the size of our pool will be very determinative of what we can do. And I like the approach of so-called Romney Care in Massachusetts, and I'd like to see something about getting Vermont in on Romney Care, if you will. And that would increase the size of the pool, and that would allow us more flexibility. And then perhaps New Hampshire wants on board, perhaps Maine gets on board, and we build up at a regional level. And I don't know how that would work, how long that would take, but the idea is to increase the pool, and in the interim focus on preventative and primary care.
Okay, thank you. We're going to switch to a couple of questions that came in advance of our forum. Now that marijuana is legal, do you support taxing and regulating it? And we are going to start with Paul.
Yeah, I think now that it's legal for Vermonters to use marijuana, it doesn't make sense to maintain a system where it's illegal to buy it from a source where the quality and the safety of the product is completely unknown. Unfortunately, it kind of leads us back to the early days of alcohol prohibition when people were, getting sick off bathtub gin. And I've talked to a number of folks who have had experiences with people in their families who have, had some very adverse effects because the marijuana that they were using was not just marijuana. So I think, to me, the big issue about moving towards a legalization model needs to be to eliminate the black market. Everything that was wrong with alcohol prohibition is still mostly maintained in the current status for marijuana. You have the only place to obtain it is through illegal means, or a very small percentage of people can grow it themselves or are comfortable with that. So I think we need to move to a model where it's available commercially, and like every other product that we offer on the market, there's some very basic safety tests so that consumers are protected. In the House, I voted against a huge big government bill that required a $30,000 permit to be able to grow marijuana. That's insane. All we're doing is protecting large companies, and my big concern with a model that looked like that is we're going to have big tobacco come in, and they're going to do the same thing with marijuana. That's not going to help Vermont. It's not going to help Vermonters. I think if you're going to have a system that's where marijuana is legally available and commercially available, we've got to focus on making the barrier to entry appropriate and not so out of pace that Vermonters who are already engaged in other activities here can make it easy for them to add that to their current model of services rather than larger companies coming in from out of state. So I think it makes sense to make it commercially available, and I think it makes sense to apply the same tax that we might have either on regular sales tax or be willing to look at the way that we tax cigarettes on a weight measurement rather than a price measurement, because who knows what's going to happen with the price. That's a big concern I have about like the RAND study, is we have no idea what prices are going to do once it becomes commercially available, especially with what's going on in other states. So I think treating it a lot like alcohol or tobacco or other controlled substances seems to make sense given where we are today.
Okay, we're talking about taxing and regulating marijuana. Debbie.
I, too, agree that we should have a regulated industry. I voted in favor of the Senate bill that would regulate from seed to sale, and I'm sorry that wasn't what we actually finally wound up with. 80,000 Vermonters, we've been told, already use marijuana. It doesn't make any sense for us not to regulate it to make sure that the quality is there, that it's not laced with other substances. Frankly, it doesn't make any sense not to get the revenue from that. And I think it's important what we spend the revenue on. I do have a concern about our young people. I know that sometimes young people can feel that if something's illegal, then maybe they won't try it. But as soon as it's legal, well, then maybe it's a little more attractive to them. So I think we need to make sure that we spend some of the revenue on education and prevention programs. I think we also need to come up with some kind of field sobriety test for marijuana. But I do think it makes a lot of sense for us to regulate it and to move ahead with that.
Okay. Marijuana taxing and regulating. Joshua.
I would first like to say that teenagers do not seem to be deterred by its illegality in any other state. So I'm also in favor of a tax and regulate structure for all the reasons previously stated. Safety. One thing I would want to be very clear to note is I don't want this to be sort of a fund source for anything outside of, as you said, prevention and education about drug abuse. If you'll pardon the pun, I don't want the state to get addicted to this as revenue for something else, because then we have this perverse incentive structure where we need more people smoking. And I'd be against that, but taxing and regulating it, and that's the next step, yes, totally.
Okay. Ginny.
Thank you. So we did pass the seed to sale bill a couple of years ago in the Senate, and it was then rejected by the House. So we ended up with a current system of deregulating or making legal lower levels of marijuana possession. So the issue is how much money does it raise? And I know the tax department has said that it doesn't raise sufficient funds to do everything that we would like it to do, so would only pay for the administration of the program. So we want to know that up front. We didn't have that information when we previously passed the bill. The other issue is, and I agree 100%, that prevention programs need to be in place, and I believe they should be in place before the tax and regulate system goes into place. So there's a lag time, and we need to get the money from somewhere. Perhaps it's the tobacco settlement funds that we've recently gotten. There should be some more of that coming in. But I agree with those who say that we have to be careful. A fund that would come in from the taxation system for marijuana needs to be protected, so that it goes for prevention and it goes for the ag agency to oversee the growth of the marijuana to make sure it's not contaminated, needs to be sure that it's labeled accurately and that access is prevented for underage folks. Age of 21 seems appropriate, but even though the literature says age of 25 is better for the use, it's really unfortunate that this drug, which is now a medicinal drug and carefully managed by our medical dispensaries, this drug is seen as a Schedule I drug at the federal level, so it's seen as having absolutely no value, and yet we know that there's value for medicinal purposes, and we're seeing that people are using it and can use it without running into either health or legal problems once they're older and use it moderately. I am concerned. I did talk with someone the other day who was raised the issue that if we start a tax and regulation program, we are going to see the bigger businesses targeting people who are open to addiction, the same way that the ads for alcohol might target someone open to addiction. So we need to do this carefully, but I think we did a good job with the bill a couple of years ago in the Senate. And I'd like to see that bill come back and reevaluated.
Great, thank you. We have another question that came out from the audience. The Trump administration, as part of its efforts to dismantle the Affordable Care Act, ACA, is now allowing small employers to leave the small group marketplace through their associations. There is broad agreement this will lead to higher costs for those who are left in the individual/small group insurance pool. Some people believe this will put the stability of our health insurance marketplace at risk. Do you share these concerns? Will you work to prevent this from taking place? And Debbie, we're going to start with you.
Okay, thank you. Well, yes, I think part of the dismantling of Obamacare, the Affordable Care Act, is that removing the requirement, the mandate that everybody pay into it has been a terrible detriment and has led to even more rising costs. You have to have, if you view healthcare as a public good that everybody is going to need at some point in their lives, then if we all pay into it, it will make the payment structure more equitable overall, and it will keep costs down, and it will keep the premiums reasonable. It just really stands to reason. So I think that the Trump administration has been sabotaging the Affordable Care Act by making these changes. And yes, I will do everything I possibly can to ensure that we continue to view healthcare as a public good that every person deserves and that everybody needs to pay into, because they're going to use it even when they're younger and healthier. At some point in their lives, they're going to need it and use it. And just as we require Social Security and Medicare, even younger people have to pay into it because they're going to use it on down the line. That's the way we need to think of our healthcare plans as well.
Okay, so we're talking about healthcare spending through exchange versus association. Joshua.
I would actually second what Senator Ingram said about the idea of people being able to leave the pool. I mean, that was my point earlier on. If we have a smaller pool, that leads to greater instability. And again, in a small state, that's not something we can well afford. So were I elected, I would seek to fight that move, yes.
Okay, Ginny.
Thank you. So we did pass a bill last year. It was in Senate Finance that the Department of Financial Regulation brought to us, asking us to allow for these small association plans. The question that we had at that point, I was very concerned about these plans becoming outside of our ability to regulate and oversee. So we were reassured that we can keep keep people together. The benefit is that many small businesses that might have a difficult time helping their employees now have a way to provide health care. So one of the things that I would like to look at going forward is will these plans also be able to access exchange plans. Will these plans provide for co-pays and deductibles that are not exorbitant? So there are a lot of questions. This is a new wrinkle. I think we're all concerned that it will lead to a disassembly of the Affordable Care Act, which it shouldn't, since the state can regulate and can oversee. But I do share the concerns that Senator Ingram mentioned initially. We will be working on this, and we will be listening to our small businesses. I know that the Vermont Vermont businesses are very supportive, but they may not be supportive if all of a sudden people are going without or having to pay high co-pays and high deductibles.
Okay, we're talking about healthcare spending through exchange versus associations. Paul.
Yeah, I think I couldn't disagree more with my other three colleagues here. There is no place that a one-size-fits-all model is more inappropriate than healthcare. I mean, the way that we interact with our physician and what needs to happen in that arrangement, it's totally contrary to the thing that government does well, is do one thing the same for everybody. You build a road, everybody uses the road, they need the same kind of road. With healthcare, it's completely the opposite. Everybody needs something different. I just was speaking with somebody earlier today who said that 20% of hospital budget is processing insurance claims, right? And the problem is that providers, whether you're a hospital or a physician, your hands are tied, right? Because you have to take that kind of insurance. Because Vermont has gone from having a place where we had 10 or 15 insurance companies to 2. And really, it's mostly one. About 80% of the state or something like that uses Blue Cross Blue Shield. So providers have lost their ability to truly be independent. I think we need to get to a place where we have more choices for people. I think it's important not to think of these association plans as some foreign, newfangled thing that we don't really know anything about. We had this in Vermont a couple years ago. The Chamber of Commerce used to provide health insurance plans to everybody. That's the kind of thing that is an example of an association plan. We used to have it. Obamacare took it away, took that choice away, and it also really hurt a lot of our chambers of commerce around the state. A lot of them used the revenue from those premiums to fund the chambers and provide economic development. And I also just want to touch on a couple things as a rebuttal from the last round. Folks are talking about ACO. Again, this is kind of a recycled model of the HMOs, another failed policy from the 90s. And when we talk about Medicare for all, we all have Medicare. I have Medicare. I'm paying for Medicare right now, and I won't get to use it for 30 years. And even the people like my clients who are on Medicare, they're using it. A lot of them need a Medicare supplement to make sure that they get their coverage that they need. So the only reason Medicare works is because we're taking money from people like me for 30 years, taking that premium and never providing benefits. Okay, if any insurance company tried to do that in the state of Vermont, take premium from somebody and deny every claim for 30 years, we'd kick them out. Okay, so the idea that Medicare for all is going to be a simple, easy solution and everybody's going to get everything they want, the numbers just don't work for it.
Can I just say one thing about Medicare? You're paying in for the future. That's what Medicare is. So if we had Medicare from the time you're born, then we'd be paying in and be utilizing it. The problem with...
What would that cost?
Well, I'm just saying, do we want to do that? You can answer that for yourself. But I do believe that Medicare is an extremely valuable program. The problem is we haven't funded it sufficiently over time, and we should be increasing the funding for that. Rather than every year the Social Security goes up minimally or not at all, and Medicare goes up even more. I know it's predicted to go up another couple $100 next year, 100 and something next year. So yes, and people do need supplements. Why do they need supplements? Because it's not sufficient, and we need to make sure that it is sufficient. That's a federal level issue. On the association...
But Ginny, if the feds can't do it, what makes you think that the state of
The
Vermont
feds
is going
can't
to
do
make
it. Right now we have a roadblock in Washington, D.C., and we should be having a conversation rather than an argument. So it's, if you can talk about how can we get to where we need to be with health care, I would say I ask our congressional delegation to do that and others from other states.
Okay, I'm going to stop you there just to give
Okay.
other folks a chance. Joshua, and then, excuse me, I'm sorry, go ahead.
Well, I was going to ask you, if we have these smaller plans, doesn't that introduce more instability in pricing? Isn't that precisely the point? We want larger pools to have stability in the pricing for everybody and be able to contain costs better. It doesn't seem to make sense to me to make smaller and smaller fragmented pools, unless I'm misunderstanding you.
Well, what happens is if you have one big pool and there's a problem with that pool, everyone suffers, right? I mean, that's one of the problems that we have with our Medicaid system, is we have one big pool, but when there's cost, utilization costs are high, it gets moved around, and the only thing that the state is able to do is keep rates low. That's why providers are getting paid about 42 cents on the dollar. If we didn't have the private insurance market that we have, a lot of physicians wouldn't be able to make it. They certainly can't maintain their practice on Medicaid rates, and even on Medicare rates, it's a tough cost. They need insurance companies there that are paying those higher rates to keep them sustainable. The problem is that these physicians have a huge chunk of what they need to charge is going to processing the claims, because if they don't take Blue Cross, they have no patients. A few years ago, when we had places like Golden Rule, a lot of my clients remember that, we had a multiple number of policies, so physicians weren't bound to the insurance companies. They were able to narrow what they were going to offer, and it gave patients and the physicians more choice.
Debbie, do you want to jump in?
I would like to. Every other developed country in the world has some kind of system that pools people's resources and provides health care for them, and they spend less money and they have better outcomes. I look at healthcare in the same way that I look at our fire departments, our police departments, our libraries, our roads. There are certain things that really don't fit the capitalist model of having lots of choices and letting consumers and the free market decide things. There are certain things like, and I would put healthcare in that same category with the fire department and the police department, where we're better off when we all pool our resources and create a more equitable system. There's so much money already in the system. In Vermont alone, we spend $4 billion a year on our health care. It's a matter of moving from premiums that are set by commercial companies that vary greatly depending on a lot of different factors, to having a system in which we can make it more equitable and we can actually reduce the costs and provide better care.
But we've been on that track for over 10 years and costs keep going up.
But we haven't gotten to the point that we're trying to get to. We still have premiums.
What evidence do
So
we have
I'd like
that
to
road
insert
is-
a comment, if I could. You know, we're starting to move on to a conversation about all payer and how we pay per patient per month. And that system right now is in the state of Vermont, is in its second year of, and we're looking at how will all payer work. If you pay a physician or practitioner for each patient per month, then the patient that accesses a lot of care gets a lot of that money is used up, and the patients who don't get a lot of care, that money may be left over, and at the end of the year there's a
So you're saying
balance.
it's more profitable not to treat people?
I'm saying it may be more profitable not to treat people, but that doesn't mean that quality goes down, and that is where oversight is so critical, and that's what our Agency of Human Services and the University of Vermont Medical Center is doing right now. They're working together to decide, is this a good way to care for patients, particularly those in primary care, and then moving forward into other specialty
I'm
care.
going to stop.
We
I know
probably
this. We
should
could have
move
another
on.
hour on this, and I'm all over it. But I do want to make sure that the folks who submitted questions get them answered, and we're almost out of time, believe it or not. So I want to ask you all what your opinion is on the Explain the Asterisk legislation campaign. Do you think college students that are dismissed for sexual misconduct should be able to transfer to schools with no notation on their transcript as to why they were dismissed? And looks like, Joshua, you're going to start us off.
I think with respect to that, there should be some notation if there was, again, not just on the suspicion thereof, but if there was an actual provable juridical something like that, then yes, it should pass along, absolutely.
Okay, Ginny. Now you're all going to be really short, and then I'm not going to have time. This always happens to me. Everyone's going to say yes, no, yes.
The person who was interested in this legislation actually contacted me, and I said, as long as some incident that's been demonstrated to be true, yes, absolutely.
Okay. Paul.
Yeah, I guess I'm not as familiar with this issue, but I'm just wondering if there's a case of sexual assault, it seems like that's a crime. Those people should be in the criminal justice system. But if for some reason they're not, I think as long as there's due process and there's actual findings of guilt, any conduct, whether it's sexual misconduct, whether it's physical violence, anything that a student does that makes them a danger to other students ought to be mentioned when that university is accepting that student. It feels like that's that should be information that the university has at their disposal to decide whether they want to accept that student. Again, as long as it's been demonstrated that there's actual misconduct.
Debbie.
Well, in principle, yeah, I agree with everyone else that we I think we're all aware and much more sensitive because of what's been going on in the country of making sure that survivors of any kind of sexual harassment or assault are taken seriously, and that the perpetrators of these kinds of things are held accountable. But in setting up a system like that, we need to be careful also that we don't, label people who may not have, in fact, done anything. I mean, things need to be verified, and they do need to be explained. And we also, I very strongly believe in giving people second chances. And if people can learn from their mistakes and their misconduct, and can make changes, then we want to not label them in perpetuity, but give them a chance to learn and to grow and be different in the future.
So we had agreement on that one. All right. Good. So I think what we'll do is we're going to go into closing statements. Believe it or not, I know it went really fast. It always does. Okay. And so 2 minutes closing statements. Ginny, why don't you start us off?
Oh, thank you. Thanks again for allowing us to be here together. You've heard a lot of interesting comments tonight from folks. One of the things that I value about the Senate is that we do tend to work together. We work in committees, and we listen to one another, and we listen to others consistently. Our perspective changes a bit when we look at some of the information that comes to us, and that's a good thing. And one of the things that I enjoy doing is staying in touch with my constituents. I hear from constituents summer, winter, fall, and spring, and I thank you all for that. I appreciate the comments, and I appreciate the information that I receive from you. It isn't unusual for a constituent to send me an idea that becomes a really important bill. For example, this year we'll be working on, I hope that we'll be working on an inclusive equal rights amendment. I'm very concerned about some of the issues that are going on in our state with respect to our minority population. I'm also very concerned about what's happening at the federal level. So I look forward to representing everyone in the Senate, and thank you very much.
Great, thank you. Paul.
Thanks. I have to say I've been doing these debates for a few years now when I was a candidate for the House in Essex, and this is the most fun debate that I've been a part of because I feel like we really had a robust discussion about the issues. And if you vote for me for the Senate, that's what you'll continue to get. I hear a lot of information that is good and helpful, and earlier today we did a press conference on criminal justice reform measures that I think can make Vermont a safer and a place and yet can also provide redemption for folks who demonstrate their ability to reintegrate with the community. So I just want to go back to that idea that my two focuses really are helping to boost the economy, creating a focus on entrepreneurs and helping sole proprietors get from that 0 to 1 employee, helping them bridge that gap. And then the second thing we unfortunately didn't get to talk about is the opioid crisis and meeting that head on and addressing that in a way that's understanding that we have to help folks, and the focus that we put on that issue is going to yield us results in other places as well. So if you're looking, as many people are, to keep young people here in Vermont, if you want to keep businesses here in Vermont, then I hope you'll vote for me, Paul Dame, who's a young president of the Vermont Young Professionals and a business owner. My experience in living in Burlington, living in the outside Burlington area, helps to make me a senator for all of Chittenden County.
Great, thank you. Debbie, closing statements.
Great, thank you. Well, I'd like to ask the folks who are watching to vote for me on November 6th or to go early and vote. I would appreciate your returning me to Montpelier. If I get the chance to go back, my top priorities will be, again, passing legislation to raise the minimum wage to $15 an hour over a gradual period of time to help our Vermont workers, and also passing paid family leave, which I also think will help Vermonters. We have too many Vermont families where both adults are working 2 or 3 jobs just to make ends meet, and to me that is just wrong, and we need to do something about it. So those would be my top priorities. I've also spent a lot of time working on systemic racism. I was the sole sponsor, actually, of the Systemic Racism Mitigation Board that we did finally get. There was a few hurdles there with the governor, but it has been passed and it is in place now. And I also would like to introduce an amendment to the Constitution to remove all reference of slavery in the Constitution. And as Senator Lyons said, work with my colleagues to do a lot of other things to improve the lives of Vermonters. And that's the reason that I run, and that's the reason that I'd like to return again.
Thank you. Joshua, closing statements.
Yes. Good night, everybody. It was nice to talk with you. I am, like Paul, upset we didn't get to a lot of particular things. My particular agenda, you'll see it if you go to my Facebook page, it's No Wasted Votes. It talks about how we can make every vote count, and that ties into things like systemic racism. Again, unfortunately, we didn't have time to get into the depth and complexity of that issue. It really means a lot to me. And we also didn't get to talk about education. As a teacher, that would have been a very welcome conversation. Likewise, as someone of the Essex Planning Commission, issues of planning and how they relate to affordable housing. But again, those are all on the webpage, and I look forward to your vote on November 6th. Thank you.
Great, thank you. And thank you all so much for coming out tonight. We really appreciate it.
Thank you.
We want to let everybody know, of course, they can vote now early at Town City Hall, which I used to always forget to say, but that's really important, I know. Or to vote on Election Day, which is Tuesday, November 6th. And of course, stay tuned to Channel 17 for our more continuing election coverage. Thank you and good night.